Hi everyone. So our app is called MATE, which is short for Medical Assistance Timely, Easily. So we want to highlight the problem the background of the problem. There is lack of information on how to find a healthcare specialist, especially in the case of rare diseases. There are limited resources for people living with rare diseases, and there is fragmented care of delivery and lack of coordination of services. Also, the rare disease community represents a significant cause of illness, and it makes considerable demands on the resources and capacity of the National Health Services. And there are also a lot of hidden costs associated with rare diseases, some of which can be how to find the correct healthcare provider, since usually they bounce from one doctor to another just to get proper diagnosis or even get a proper treatment. So, in one study, it was found that at least 90% of people from the rare disease communities use the internet for finding a physician or specialist related to their child's disease. So, what we propose is to bridge this gap in healthcare and to help to guide the user to appropriate care. The audience that we would be targeting are those diagnosed with rare diseases currently under care and those seeking treatment. So some of the main features of our app would be just in general information about the disorder, finding a primary care specialist, finding additional resources like just even restaurants which are more accessible to people living with these rare disorders, participating in ongoing clinical trials, and if they have been to a healthcare specialist, just reviewing their visit. Sorry, I don't know what happened. Uh, I think I just. So we want to come to the app demo.
Okay, while we open this, I just wanted to mention that we have a fully functional uh, mobile application which is ready to be run in both iOS and Android devices. So we wanted the UI to be very user friendly. So here you can see that the user just has to enter a symptom, and once he enters his symptom, like it redirects the user to this page. So the first page over here is specialist. So it will give you a list of all the doctors that specialize in this particular condition. In this case, it's HPS syndrome. The second tab you can see is like the list of trials. Uh, so all the active and pending trials that are going on. And if the user wants to, if there are no trials, then there's an option of being notified if a new trial comes in. The third aspect is uh, supplies. So one thing that everyone takes into granted is like even if someone has been diagnosed with some particular disease, there are a lot of things that are required for his day-to-day activity that people ignore, like just um, finding wheelchairs or like oxygen supplies. So we wanted to cater to that problem as well. The fourth, and one of the most important facts is like build a community for the community for patients which have an overlap, and so that they could communicate and like gain information from each other. Yeah.
Thanks very much.
Open to questions.
It seemed like the entry point into the app is having the correct diagnosis.
Yes.
Then if somebody has the correct diagnosis, why are they going to keep looking for other specialists?
Just because there is, I mean, we do know that people with rare disorders, it's much more complicated, and they do look for specialists. And if they're not satisfied with the treatment they are undergoing, then they might turn to the internet to look for other healthcare providers, and especially based on other reviews of people who are suffering from the same disorder. So we wanted to do something to address that.
These communities are kind of hard to maintain, to upkeep. Have you thought about curating content, or how do these communities gather around the app and contribute into it and recruit into it? How do you build a population?
Yeah, so we were actually thinking of using Facebook or even like Twitter as a means to advertise this, and also we were actually thinking of incentivizing it through like maybe maintaining points. If you go online once, you get some points. Maybe link it through websites like Swagbucks, so that you kind of can score points just for using this app. Like we were thinking more on those lines.
Okay, thank you very much.